Hello, welcome everyone. It's so nice to see you. Thank you for joining. We're just going to wait for a couple additional people to come in with us. If you're not speaking, just place yourself on mute. And I would love to hear what inspired everyone to join today in the chat. So we definitely want to use the chat as an engaging feature to engage people. So if you want to start by just sharing, what made you curious to join? And then throughout this conversation, we definitely want to capture all questions. So feel free to add your questions in the chat. And we are recording. Great. So let's see, I'm going to look at the chat and we will begin in just a minute. So someone said they're considering a tune-up and they want to learn more. That's great. As we know, sometimes people do a ketamine therapy protocol and then they want booster sessions as a refresh. Any other reasons someone might have joined today? Feel free to pop it in the chat. We will begin in just a moment. Welcome. And then someone else said they're currently doing MDMA and just interested in these updates and interested in ketamine. Great, lots of viable therapies out there. Excellent. Nice to see some familiar friends and faces. Okay. So why don't we dive in? So thank you so much, everyone, for joining. Today, we have the pleasure of having Dr. Stephen Radowitz, Chief Medical Officer and co-founder of Nushama, joining. By the way, is everyone hearing the, when people keep jumping in, the sound, or is it just me hearing the sound? Okay, that's the one thing I wish I could, I'm gonna undo that. It's no longer going to play that sound. Okay, we're good. So we've got Dr. Stephen Radowitz, Chief Medical Officer and co-founder of Nushama, who I have the pleasure of working with. Since October 2021, Nushama has opened and is still the largest psychedelic wellness center in the Western world. Dr. Stephen Radowitz and his team are the leading medical team, having overseen now close to 10,000 journeys for mood disorders with ketamine. And so we're really excited to share some new data and updates with a study that he has led, but also to do a comparison of MDMA and PTSD, MDMA and ketamine for PTSD, seeing that we are gearing up for legalization. So MDMA legalization is upon us coming this August, and the rollout will take some time. But there are a lot of options and new legal options to explore. So we're really excited to have Stephen here today. After all, nearly 1 in 10 Americans will suffer from PTSD. So this new information to educate people, whether you're coming here learning for yourself, for a loved one, whether you're a journalist writing a story and want to educate people, today we can dig into the issues. So what we will do is we'll start with a very short ketamine therapy introduction, like Ketamine Therapy 101. Then we're going to dive into ketamine versus MDMA for PTSD. And then we will introduce the preprint study stage and learn about what Dr. Stephen Radowitz has found. The study was submitted as a preprint at this stage and is currently undergoing peer review. So let's dive in. So Dr. Radowitz, welcome. We're so happy to have you with us. And for anyone, yes, for anyone new in the audience who might not know, what is ketamine therapy? Who is it right for and not right for? Please share a ketamine therapy 101 for people.
Yeah. So thanks for having me here, Marissa. So IV, or ketamine in general, is an anesthetic agent used and developed in the late 1960s. It was an unusual anesthetic agent in its safety. Its safety in that it didn't affect people's respiratory drive, its heart, cardiac function, its gag reflex. It was an unusually safe drug. And over the years, through various studies and experiences, we've found that it was incredibly effective for mood disorders, especially treatment-resistant mood disorders. So it's associated. It's known as a dissociative anesthetic, although not in the typical sense, the word dissociative. It's more of an ego dissociative, not emotional dissociative, in that it gives us an opportunity to remove or to, as a psychedelic, to move away from our usual sense of self, and allows us to see and appreciate our experiences from a different perspective.
And so, what are the top indications that ketamine therapy treats at Nushama?
Yeah, so we treat at Nushama, we treat a variety of treatment-resistant mood disorders, from major depressive disorder, depression, general anxiety disorder, PTSD, post-traumatic stress disorder, as well as OCD, a variety of addiction, alcohol use disorder. We have a separate program for that, and other types of addiction, and eating disorders. We've had incredible results with various eating disorders, especially a bulimia, or binge purging type of eating disorder.
And particularly with this study that we'll see coming up, but as part of our introduction, tell us about the role of preparation and integration therapy with psychedelic and ketamine therapy.
Yeah, we found in a lot of the studies and our experience, and most work with psychedelics, it's very important. We feel it's very important to prepare people for the experience, so that they feel safe, they know what they're getting themselves into. They have some intention, and they're having an emotional connection with it, and then and feel safe going into the experience. And when they feel more safer, and they emotionally and physically going into it, they are more likely to let go and gain the most from it. And then after the experience, to do an integration integration sessions, which really help people integrate what comes up in the experiences, and to apply those changes and what the experiences into their day-to-day life.
Wonderful. So thank you so much for the Ketamine 101 for anyone who's not familiar. There's a lot more we could cover, but today we want to get into ketamine versus MDMA. So for people who are new to psychedelic therapy, if you look at the pure experience of it, the psychedelic experience, what is the difference between ketamine and MDMA? And please note, we're mostly talking about IV ketamine, and that is the type of ketamine that Nushama uses. Some people might be familiar with a little bit of intranasal that they might have had at a party. This is a much different kind of therapy. So how does this higher dose ketamine compare to an MDMA experience, Stephen?
Yeah, so ketamine is very different. There has different effects at different doses and different routes of administration. So we use IV ketamine in what's called sub-anesthetic doses, so usually below 2 milligrams per kilogram. And in those doses, and above 0.5 milligrams per kilogram, and in that dose range, it does induce more of a what's called a psychedelic type effect, or a more mystical experience, or an ego dissociative experience, which we found very helpful in treating mood disorders. It doesn't, it's like some other psychedelics, traditional psychedelics, like psilocybin, like LSD, which can cause different types of visual alterations, even with your eyes open. This doesn't tend to do it. How it works is with an eye mask. Everyone wears an eye mask and noise canceling earphones. We have about 12 different playlists, it's curated playlists, and the music, it's called synesthesia, what really drives the entire experience and induces very vivid, dreamlike sequences. But if you take the eye mask off and the earphones off, those generally go away. MDMA is not a traditional psychedelic. It's not known as a psychedelic. It's called an empathogen, or more of a what they call a heart opening agent, and it induces a more of an compassionate or empathetic view. So things that come up in the journeys enables people to see their life and different difficult situations in their life in a much more open way, with a little bit more curiosity and ease. And that's so.
Wonderful. You touched a bit on safety in your opening about ketamine. Can you talk about the safety profile in comparison, ketamine versus MDMA, and also talk about the concerns around conflicting contraindication medicines?
Right. So, I mean, they're both relatively safe medications. MDMA is, is an amphetamine isomer, so it's like an amphetamine. So it tends to increase the heart rate quite a bit. It can cause, some of the side effects. It can cause jaw clenching, muscle tightness, increases in body temperature. Issues with heart, people with, underlying heart conditions would not be a candidate for MDMA. Ketamine works in a different way. It is not an amphetamine. It's more of an anesthetic agent. And although it can increase blood pressure transiently during the treatment. It's an unusually safe medication. It does not affect respiratory drive, neither does MDMA. It doesn't affect the heart function in any way, or usually the blood pressure, the heart rate, and it doesn't affect the gag reflex. So both are relatively safe agents for most people. Now, as far as contraindications, MDMA it works by releasing large amounts of serotonin into the synapses in the brain, certain regions of the brain, and also decreases the reuptake of that serotonin. So it causes a sort of surge of serotonin. So people on medications that tend to prevent the reuptake, serotonin reuptake inhibitors, SSRIs like Prozac, Zoloft, Lexapro, or SNRIs like Effexor, Cymbalta, it would be a contraindication. You cannot be on those agents while receiving MDMA because it can cause an excess amount of serotonin, and people could develop what's called the serotonin syndrome. So those people, anyone who is a candidate for MDMA would have to wean off any of those agents to go on it. Ketamine does not cause a release of serotonin. It does affect certain serotonin receptors, but it's not the main effect. So it can be used. The nice thing about ketamine is it can be used with most psychotropic or psychiatric medications without a problem.
Great.
Yeah.
So if there's anything more you'd like to share about, which is suitable for which person as a choice from what you've seen and predict in the future. Obviously, Nushama is not offering MDMA yet, but will when it's legal. But when people are looking at their options and things, what is safe and right for me? Any other factors you'd like to share?
Yeah, I mean, I think as far as MDMA, the treatment protocols are very different, for MDMA. So the way it's worked with the MAPS program, in the study protocols, MDMA is given in 3 treatments, usually spaced out by a month apart. So it's over a 3-month period with significant preparation before each treatment and integration after, as we do here with our ketamine program. The issue is, the longevity. So as far as treatment, they have to be observed. And it seems that we don't know the final requirements for MDMA. It hasn't been officially approved, but it looks like they will have to be observed for the period of time that they are under the influence of the MDMA. MDMA is a much longer acting substance. The drug, when given, it lasts for about 5 hours. So, from the beginning to end, it's probably about an 8-hour process. With ketamine, ketamine is in and out of the system. It's very short, has a very short half-life. So people are in and out of our center usually within about 3 hours rather than 8 hours. So it makes it a little bit easier to work with. Our ketamine protocol is given over it's a series of 6 infusions, 2 infusions a week over a 3-week period. So rather, it's a 3-week period versus over about a 3-month period with MDMA. So, you have to take those things into consideration. We'll talk about costs and all that, which would also be a consideration when considering MDMA. The cost will likely be much higher versus ketamine. And then as well as, being able to come off the medication. So there are more drug interactions with MDMA. So, majority of people who have PTSD are treated and are currently on a variety of different psychotropic medications. So, being able to wean off of those in a reasonable period of time would be a significant consideration and being in the choice of whether, you use MDMA or ketamine.
Okay, important factors. So let's talk a little bit more about those costs and barriers. I know that the protocol at Nushama $4,800, 6 treatments over the course of 3 to 6 weeks. What would the cost in comparison look like for MDMA, for example?
Yeah, so we only know, MDMA has been approved for mood disorders, PTSD, in Australia. And the first clinics have started to offer it at a cost of 24,000 Australian dollars for the protocol, which is a series of three treatments with all the, obviously the intakes and psychotherapy and therapy that's, supporting it. So, it comes out to about $8,000 per treatment, which is quite a bit. We don't know how that's going to work here. There are some concerns, it depends on how, what the requirement FDA is going to require as far as a REMS program, risk mitigation strategy program. There will be certain requirements when it's made legal. So right now, it looks like they are requiring at least 2 practitioners be in the room the entire time with people being treated with MDMA. And there are some significant cost considerations then there. And also, the longevity of it, being in the clinic for about 8 hours also will have some, limitations. And, there might be ways to mitigate some of the costs of that, maybe groups, if it's allowed to be used in groups, that might help. So there's some things that they're going to work on, I'm sure, as they roll this out after, if it is approved by the FDA. In its rollout, they'll come up with some ways to make it more cost effective, I'm sure.
Sure. Now, if we get into what it can be prescribed for, ketamine is prescribed, off-label as a mood disorder treatment for, I think, about 12 different types of mood disorders. Ketamine will be specifically, MDMA will be specifically for PTSD. Could it be prescribed off-label? Do you know anything about that use?
I don't yet. I think there will probably, when it's first released, there'll probably be some significant limitations on how it can be, what it can be prescribed for by the FDA. And even then, insurance, $24,000, unless someone's paying out of pocket, if insurance does decide to pay for it, there will be some significant limitations. They will require an FDA approved indication for it. And likely, evidence of, failed past treatments, a number of failed past treatments, in order to get it approved for use.
Okay. That gives us a nice foundation. We went through a ketamine 101. We went through ketamine versus MDMA for PTSD. Now let's get into this preprint study, because there's a lot of very interesting information here that informs this comparison. So Stephen, what was the impetus for this preprint study? And I just want to emphasize to people who are here, this was a preprint study, the largest IV ketamine for PTSD study to date with 117 participants. So what was the impetus for this study?
Well, we noticed as people came in, our initial indications for treatment were mostly, treatment-resistant depression and anxiety. Those were our main. But, in our intake, we talked to people about, past trauma, traumatic events. And I'd say well over 90% of the people coming in here have some type of trauma, developmental trauma, or difficult life experiences that were never really processed in a proper way. So, trauma is a very common, traumatic events are, is a source for most, majority of mood disorders. It doesn't come from nowhere. And then, we also asked people, and we started offering people, we had people fill out questionnaires. If they did report a history of trauma or PTSD, they were filling out these it's called a PCL-5 questionnaire, which would measure, it's based on the DSM criteria for PTSD. And we saw, we'd have people perform the questionnaires before and after completion of our protocols. And we saw significant reductions in their PCL scores, in their PTSD scores. So, we were working with some people from Colombia, and we saw this is really important information to get out there. We know there's a lot of work being done using MDMA, but that's the ways off. And, if there's something that we can do to help people majority of the people that, we see, everybody, I think about, I say about 90, I think over almost 97% of our participants in a study had been on various psychotropic medications before coming in to see us. They've been through many years of specific CBT, different types of psychotherapy, and have failed those those trials. So the improvement we saw with our ketamine protocol was pretty impressive. So we decided to go back and do a retrospective analysis of all of our patients, and we found 117 of the people who went through our program who had completed the program and also completed a pre and post PCL-5 score, a PTSD score, and the data was pretty impressive, actually, which I can share.
And for people who don't know, the preprint was done because, as it is a protocol standard for science to have a peer-reviewed study, and this study is undergoing peer review right now, but preprint was a new trend that started during COVID when people would discover new findings that could help people right away today and not wait for a lengthy peer review process. So it's good that you put this out there. So if we think about, what are the top things you learned from the study, can you talk about the effectiveness that you found of IV ketamine for PTSD?
Yeah, so in our analysis, we found that 75% of the participants in our study had a statistically significant response, a significant reduction in their PTSD scores of greater than 10 points or more. And of those, 62% of the participants went into complete remission, where they're no longer considered to have a diagnosis of PTSD based on DSM criteria, which was pretty impressive, actually. And remember that majority of these people have been through years of therapy. People coming to us have already been through years of therapy. I think the average, on average, participants had been on prescribed 4 to 5 different psychotropic medications before coming to see us. Yeah, and I mentioned only 7 of the 117 had not received prior psychotropic medications. So that's pretty significant. So these are pretty treatment resistant, people with PTSD, and these numbers are pretty impressive. Yeah.
How do these numbers compare to MDMA for PTSD?
Yeah, so MDMA in some of the trials, the MAPS-2 trial, which was released last year, which was a phase 3 double-blind study, had about 90 patients with severe chronic PTSD. And the protocol, which I mentioned, 3 sessions of MDMA with talk therapy on either end. Only 46 of the 90 actually received the MDMA, and the rest received the placebo. And of those, about 67% went into full remission, no longer qualified as PTSD, and 88% had a clinically significant improvement, which is pretty impressive, which is also really impressive. And our numbers sort of mirror that to some, pretty closely, for a treatment that we have right now that's available right now and safe, incredibly safe, and we have years and years of experience of use. So I think both of these agents are going to have, and other future ones, maybe psilocybin in the future, we'll definitely have them. It's nice to know that we have incredibly effective treatment options for people who have really been suffering with PTSD and have failed many other treatments in the past. So.
And what else did the study show, if you want to walk us through? Because I know for me, I'm not a science person, so when I read that preprint study, I had to read it many times to try to understand. What other takeaways have you had from the study?
One of the other ones was the benefit of integration. So integration before. So in our program, and the same thing with the MAP studies, we used preparation. So we had integration coaches, usually therapists, work with our clients before and after each treatment. So we found that, and we found in the study that there was a statistically significant improvement in increased response rate in those who continued integration coaching, whether it's through therapy, through their own therapists, or group therapy, after their treatment protocol. So ongoing treatment, maybe not indefinitely, but for a period of time, definitely helps improve results. So that was a pretty, that was a significant finding. And also the dosing. I mean, we used, in a lot of the studies out there using ketamine, there have been other ketamine studies for PTSD using ketamine out there. But the doses in all those studies have been pretty much the same, 0.5 milligrams per kilogram, which is a relatively low dose. And there was no integration, no attention to set and setting. So, the clinic setting. So we put a lot of work and effort into building a center that really creates a very comforting and nourishing environment to do this work in. And also, the mindset. So, saying we send people intention setting exercises before they even come in for their first treatment. So they start working on themselves before they come in. There's a lot of preparation involved before and integration afterwards. So that's very significant. And then the dosing, our average dose in our, in the PTSD study that we, in our preprint, the average dose was 1.28 milligrams per kilogram, which is significantly higher than most studies. And we're finding, in our experience here, that escalating the dose definitely has a significant effect on long-term results. And if you look at, there was a study out of Australia and New Zealand somewhat recently that it was using ketamine, subcutaneous ketamine, so under the skin, which mirrors IV in many ways, racemic, which is the mixed ketamine, the generic ketamine that we use, to treat highly treatment-resistant depression. About 25% of the people in the study had gone through ECT, which is pretty significant, very significant. And of the people, they initially got an IRB approval, so the research board gave them approval to use 0.8 milligrams per kilogram, 0.5 milligrams per kilogram. And they saw no results, no improvement. So they went back to the IRB board. They got permission to escalate the dose to 0.9. And when they went up to 0.9 and they had deeper experiences, they found a statistically significant improvement in people's mood scores, which is really, and we're seeing that in a lot of the other treatment, with psilocybin. They're finding that higher doses, which induce a more what they call mystical experience. And there's questionnaires to sort of gauge the mystical experience. Those people did much better and had better longer-term results than those who use lower doses of psilocybin. So we're finding the same thing with ketamine.
Great. And someone asked about the preprint, and yes, it is public. And there's a blog about it on the Nushama site, and I just put the link to the preprint in the chat. Part of that headline of the preprint is about the real world psychedelic paradigm. So you talked a little bit about the psychedelic paradigm with the eye mask, playlist, preparation, integration therapy, set and setting. And then when I have to admit, when I first saw this real world, I said, aren't all studies done in the real world? I was kind of confused by that. But I learned that this real world setting is much different than a clinical setting. A lot of these studies take place, if we compare this study to past studies, in a clinical setting, in some sort of environment where someone is in a hospital or different type of treatment center, versus when you're at home and you go to Nushama and then you go home. And it was done as a retrospective of data versus someone being in a formal study. So if you might want to talk about how that might have affected things.
Yeah, I mean, I think set and setting is vital in this type of work. First of all, to let go, it's an unusual experience, so you have to feel safe, that you're in a safe environment, that you have safe, really good practitioners around you in a comfortable clinic. It still has to be a clinical setting. So we have doctors and nurses and nurse practitioners, and we have a great and therapists here that really support people. So people, when they go into the journey, they feel safe. And that really has a significant impact on the treatment. So the ketamine is just one part of it, or any psychedelic is just one part of it. Everything else around is just as important, from the music to the therapist you speak to before and after, to the room, the looks of the room, the nourishing environment definitely has an impact on the outcomes. Now, in most of the studies, if you look at most of the studies, especially with ketamine, they do not take that into consideration. It's done in very specific, clinical settings. And I understand that they're really trying to show, when you're doing clinical studies, you're trying to show, they're trying to show the effect of the compound, ketamine as a drug, and its effects on mood disorder and effects on certain brain processes. So I understand, and they're trying to limit and remove any other extraneous, possible effects that could influence the outcomes of the treatment outcomes. But we use those. All those things are part of the treatment. So ketamine, for me, ketamine is only one subset, one part of what we call psychedelic treatment experience. But I understand, in academic medicine, that's part of the process, and it's a slow process, and it's a careful process, and I respect that. But in the long run, I think we'll see that once we start to take those other things into consideration, we will have significantly better results, especially with ketamine. Yeah.
And just a couple more questions, and then we're going to roll into your questions. So, with MDMA as an available option, how will that alternative affect ketamine if we look at mental health treatment in the future?
Yeah, I mean, I think it's going to bring psychedelic, or this type of medicine, this form of medicine, we can put MDMA in a psychedelic realm. It'll educate a lot of people and show people, in real world studies, excellently, well designed studies. It'll show how that these alternative treatments are incredibly effective and safe. And without any side effects. I mean, other than the experience itself, there's no medicines that stay. Once the medicine's out of your system, it's out of your system. So it's the experience, and there's then whatever happens, neurologically during the session. But afterwards, you're not taking any there's no ongoing medication being taken. So there's no side effects. And that's, I think that's going to be a big plus. So I think MDMA will increase people's awareness of this, of not only MDMA, but ketamine. And I think it will increase people's, I think the acceptance of agents like ketamine for treatment of mood disorders.
Okay. So
not only among patients, but also among in the healthcare field, among psychiatrists and therapists, who are cautious, understandably so, in using these agents for their clients. Yeah.
We're about to roll into the Q&A, and I just want to acknowledge a couple of things before we do that. So there are a lot of people here. If you were invited here today, or if you joined, you might be learning about this treatment for yourself, for a loved one, or a friend, or a colleague. And I understand not all people are comfortable asking questions in a public forum. So if you would like a medical consult, everyone after this webinar will receive an email with instructions of how to schedule a consult. There will also be a discount link for people who joined today. And if you're a member of the media and you have more extensive questions, obviously ask a few here, but we'd be happy to set up something separately with Stephen as well. So now I'm going to get to the first question. Can you speak about the integration process after the therapy for MDMA and ketamine? All I ever hear about is doing 3 sessions with a therapist, but what else is involved? Maybe talking more deeply about it. Yeah.
What goes on in an integration session afterwards, right? I'm a purist when it comes to integration. So it's number one, discussing, we talk about, people's experience, what they come up, and sometimes what comes up in the journey is not describable in our current terms, especially with ketamine, which can be very, ketamine is a little bit different from MDMA, so MDMA works, ketamine is a very, an egolytic agent. It really takes us into other realms where it's hard to really make sense of really what you see. It's a lot of what you experience. It's hard to, there's really nowhere to store it in our memories, but it can elicit significant emotions, emotional responses, feelings, sometimes of fear, places where we feel scared or the unknown. So to be able to come in and really help bring people back into this realm, into this world, and reassure people that whatever comes up is there for their good, is there to help them. And even a more difficult experience, some of the most difficult experiences we found here at Nushama end up being the most, when properly integrated. So, really reframing it in a way that you reassure that it can be the most clinically beneficial experiences. That's what we found here. And it's all about how you see it. So a lot of it is just getting people to really accept not understanding and accept some of the things in this world that we can't understand, we can't label. We can't fully understand why someone, would sexually abuse a child, or why someone would say, the traumatic events or the evil that other people inflict on other people. Why did they do this? We can go in years and years of of therapy and years of trying to understand. It could take us to a loop. But what we can do, instead of trying to understand why, we can understand, okay, how did this make me feel? How did it influence my emotions? And how could I learn about myself? How could I grow from the situation? How can I become more wise through the situation and stronger through the situation, and learn to be more resilient and choose, and then when I go into the real world, I no longer have to see, the world through what happened to me in the past, but through where I am today, right now. So that's part of the integration process, is just reframing, a lot of reframing, a lot of reassurance, and comforting people as they process what comes up in the journey. Now, MDMA is a little bit different. There's it's not as it's more of an empathogen. So, your mind, your ego is still very much there, but it's just seeing it from a much more loving perspective, a much more empathetic perspective. So things could come up in the journey. You might, people who've hurt you could sort of be brought into your consciousness during the experience, but you see it allows you to see it with much more openness, more love, more empathy, more compassion, and forgiveness in a way. And so that can be, there's a little bit more discussion, I think, in the MDMA sessions with a therapist. There's more to unpack. It can be more to unpack in certain ways. It's a little, can be more complex in the integration process. So hope that.
And also, sure, talk a little bit about the type of aftercare involved and year-round integration past the therapy.
Yeah, so I mean, I think here we have these group integration sessions. So or aftercare sessions. We have we have in our center once a week, we have groups come together. People who've gone through our program either are currently in the protocol or have completed the protocol, which is great because you get people who really have experience with the ketamine, helping those who are sort of going through the experience. We've even invited people who are considering the protocol to speak and explore those group sessions to help demystify and get reassured what this is all about. So that's very helpful. And then we also have virtual sessions once a week. And hopefully we're going to expand that as well. We're finding that very helpful. And I think with MDMA, it's going to be hard, with the longevity and the costs. I think a lot of the idea of bringing in more group work, group integration is definitely going to play a big part in cost containment, so.
Sure, it really goes to show that people, get lasting change from putting in the work year round, that this, I've heard Stephen say always, this is a doorway, and for people to continue this work, and for places like Nushama to help support people in that, it's a very good resource.
Also I get a lot of these questions like, how long does this last? That's the big question. I don't know if it's going to come up, but it's really about how much work you put into it. Ketamine's a tool, it'll take you to a certain place, it'll show you something. But if you go back to living your life, and there's a sort of a neuroplastic process, and where these connections between our memories and our emotions are open and allows us to sort of reframe things. But if you go back to living your life exactly as you did before, and you make no changes, it's gonna, the wiring is gonna go back to that default position. So we really encourage what we call like aftercare recommendations, that really help people make small changes in their life, whether it's doing yoga, whether it's, taking up a meditation or mindfulness practice or a breathwork practice, or, reading some spiritual wisdom. We have a book list that we of books that we've read that we found helpful, or our members here who've gone through the program have found helpful. And that's a great help. Doing ongoing integration through these groups or with your therapist. There's so many things you can do, taking walks in a park, but making changes, working on making small, and they don't have to be big changes. Making small changes in your life can have drastic effects in your life, and really help the ketamine and MDMA and all these treatments work and have longer lasting effects. Yeah.
We have another question. Where will Nushama be sourcing the MDMA? Is the manufacturer based in the United States?
The MDMA, it will be made. It's called Lycos. So MAPS, well, I won't go into MAPS. They developed a drug company that's going to be producing a pharmaceutical grade MDMA, which is pure and tested, obviously, not the things that not what most of what's done and used on the street is often adulterated. It has other agents in it. It's not pure. This is pharmaceutical and FDA approved production of MDMA, and it'll be sold by Lycos, the drug company. The cost of that we do not know yet. I don't know offhand. I don't know. Yeah, but it will be somewhat costly to pay for a lot of the research that went into getting this FDA approved. Yeah.
We have another question. What expectations do you have for client volume for MDMA treatment compared to ketamine treatment?
Yeah, it's hard. There's a lot of barriers right now. So racemic ketamine, we don't have all the, we have many different indications that we're using it for. So initially when MDMA is, assuming it will be approved by the FDA, it will have a specific one indication, which will be PTSD, and treatment-resistant PTSD. So people will have to come off their medication. So that'll also limit, participants. And then the costs. We have to see what drug companies, insurance companies are going to be willing to cover it. So there's a lot of unknowns. And then just, the longevity, of having. So, ketamine's a lot easier, obviously, to administer, shorter treatments, much more cost, it's cheaper, a lot cheaper to use. And we have a lot more experience with it. So I think I don't think there's going to be a massive surge of people being approved for MDMA at the start, but we'll see how it plays out. Maybe working in group settings will bring down the costs that may make it, more accessible to more people. We don't know yet. It's still unknown. Yeah.
Yeah, I know Nushama has built a group room into its facility in anticipation of group therapy being a very good, more accessible model. What other questions do we have? Oh, go ahead.
But we have done a number of ketamine, intramuscular ketamine group sessions, which were amazing. Where we did group preparation, and a really program of 4 of these treatments over a period of time with group integration preparation and group integration after each session, and we had excellent response to that as well. So we are prepared for that.
What other questions do people have? I know we've been zipping through a lot of this. Someone asked about the books that Nushama recommends. Anyone who's visited Nushama, there is an extensive library. I just shared a blog post that has 7 of the titles that Nushama has, but maybe we could have a more extensive list that we release soon.
Yeah, you know what? I have a link to our Amazon reading list, which maybe I can try and share if I can figure out how to do that.
Oh, that's great. Yeah,
Let's see if I can share.
Has a doctor ever prescribed anyone else books to read or spiritual practices? That's great.
Yeah.
And
let's see if I can get
feel free to think on your questions. It's a nice opportunity. We have another one. Given that Spravato has been FDA approved for close to 5 years, what can we learn about the insurance reimbursement from that drug versus MDMA?
Spravato? Yeah, so we are offering Spravato now for those who, cost is an issue, need to go through insurance. It's a very different type of treatment. It is ketamine, it's S-ketamine. So racemic ketamine, the generic ketamine that we're using, has S-ketamine and the isomer in it. So it's a combination 50-50 of the two. So with Johnson & Johnson or Janssen Pharmaceuticals, they isolated one of the isomers so they can get a patent on that. And then they did all the studies. So it's really the same drug, and it's been shown to be pretty much the same drug. But it's used in much lower doses. So it's not a psychedelic dosing, it's a nasal spray in sub-psychedelic dosing. And it's used, and it's meant to be used as an ongoing treatment. So the protocol is usually a series of 2 treatments a week for 4 weeks, and then they go into 1 treatment a week for another month, and then it's an ongoing treatment based on response. And it's tough. A lot of insurance companies are covering it now. There is quite a process, a prior approval process. So people have to show that they've failed at least two previous psychotropic or psychiatric medication drugs in the past. Often some insurance companies are requiring up to 4 failed treatments in the past, which isn't so hard. We have a lot of those, and other variables. So there's a lot more work involved in getting it approved, but it's work, and we do it, and we've been doing it here for Spravato and have had good responses with that.
Great. Any other questions? Well, we have a little more time with Stephen. Well, I think we went through everything. We did the ketamine 101, the comparison, the preprint study. There's no need to continue on longer than what people would like to know about today, but I do want to just reemphasize again, not everyone is comfortable perhaps asking questions in a public forum, or some of you from the media might want just a separate time to dive deeper and maybe go in a different direction with the conversation. We did just have one pop up. How much does the music playlist affect each individual's journey?
Oh, I think it's huge. I think the music really does have I think it really does have a significant influence on what's experienced during the ketamine infusion. So it's called synesthesia. So some of the intonations will, obviously there'll be some variability from song to song. But there is some intentionality sometimes, and some of the lower tones will bring you to little darker places. And it allows us to explore some places that might be a little scary, and to do that exploration in a safe, medically supervised environment. And there's some real benefit, I think, to that. And that's where the integration comes in. So, some people don't like it, some people don't like, but, I think, and again, we found that some of the more difficult experiences here have been the most clinically significant, if properly supported. So.
Yeah, that's a big one. Is there such a thing as a bad trip?
Yeah, I don't believe in bad trips. I mean, I think it's how they're processed. There's difficult trips for sure. I mean, it's part of whenever people have to know when they do this, it's not easy work. And anyone who's gone through this will attest to that. This is not like, you come in, get an infusion, get high and feel great. It's work, It's not addictive when you do it in this way, in the psychedelic, as an infusion. It's work, and you're not running to come back here the next day. But you feel like anything, when we put work into it, you feel like you've accomplished something. And our members, it's really, that's where I think there's so much benefit. You feel like you're part of the process. You don't feel like something's being done to you. You are really, really, it's all about you. And the medicine, I always say, is, not just the ketamine, it's just really the work you do and you put into it. And even in the journey, you're lying there, it's significant. So I think people feel like they've accomplished something after they've completed their treatment here. And I think that goes into why our numbers and our results are so much better. When you take a psychotropic medication, that's about suppressing emotions. It feels like something's being done to you, and you're not involved in it. It's like a sort of bread of shame. Where with psychedelics, it's something that you're part of. It's expressing, not suppressing. And it's expressing yourself, your emotions, your everything. And once you start to become comfortable with it and explore those emotions in a safe way, you learn you can maneuver this world with a much greater ease. So, yeah.
We have another question. If MDMA receives FDA approval in August, how soon could Nushama begin offering this treatment?
How soon after? That's a good question. I mean, I think we have our one of our integration coaches, a therapist who is trained in MAPS now. There'd be one small little part he'd have to do, but probably just as fast as any center, most centers out there. I think we could incorporate it pretty quickly. We're really set up we have incredible experience dealing with these things. It would be probably pretty quick. I can't speak to exact amount of time, but likely months. Within the months. And, there's obviously going to be some regulatory and some requirements before a center can be licensed. Definitely. So, but assuming we can get through those pretty easily as we did, the same thing with Spravato, we had, there was definitely a process in getting, we had to be approved and go through a process of approval. There's a whole government or process called REMS, which helps us, monitor any type of side effects to the Spravato. And so we're used to that, and I'm sure it would be modeled very much on something that we're doing with Spravato. So we'd be well set up to do it pretty quickly and to do it well.
Another question. Do you think that eventually we will have at-home protocols that are as effective as your in-office IV sessions? And that was the question. And then so I think it would be good to have you answer that question, Stephen, but then also talk about the safety of your perspective on the safety of at-home treatment.
Yeah, there's a lot of at-home companies now. So the numbers, I don't think I could tell you, I'm sure it's not as effective, and the problem with the at-home ketamine is it's relatively, it's lower doses. All the studies, almost all the studies with ketamine have been done with mostly IV, maybe that one subcutaneous that I mentioned, where there's a sustained infusion, a consistent infusion of a relatively, sub-anesthetic, but a higher dose, psychedelic dose of ketamine. When you're doing the lozenge, the home treatments, although you can get into a temporary, deeper experience, it's nothing. It does not bring you into a sort of more of an egolytic or a deep psychedelic experience. People can take more than what's prescribed, of course, and temporarily go into a very deep experience. But again, the support around it is not there. The safety is not there. And the numbers, and we've had a number of people come to us that have done this at-home ketamine and have not had good results, or long-lasting results. And it's being, diverted. I know people are taking it, and, someone told me they went and they didn't even have any mood disorders, and they went on to one of these, a Mind Bloom, and they were able to just lie and get approved for the ketamine, and they're using it recreationally, So there's a problem with diversion for sure, But even for the people who need it, it becomes more of a, when you're using it in smaller doses on a more regular basis, it's another suppressive agent. It's just, you feel anxious, you pop a ketamine, and you'll feel good. You'll feel good for a few hours, maybe in a day, but it's not getting to the heart of the problem. You're not really curing, you're not treating anything at its heart. You're treating symptoms. You're not treating the underlying issue. And we already have a lot of agents doing that now, suppressive agents. We have, all the benzodiazepines people take when they're stressed. People can smoke weed. There's other ways of sort of escaping our issues. Real psychedelic medicine is not about escaping. It's about going into them and going through them and processing them and then moving on. And I can't say it's a cure. It's a real treatment. It's a real it treats the seed of people's issues, not just the symptoms. And so, I mean, there's going to be people who'd rather do that don't want to do the work, but I don't, I'm not a big fan of at-home use. I've seen it's definitely significantly abused. And I've heard multiple stories of that. So I think it should be done in a clinical setting. And my concern is that this abuse, could cause problems, as we've heard, and, there's been some cases of it, in the media of people having bad outcomes using it in a non-clinical setting and, in swimming pools and hot tubs and stuff, which is, very dangerous. Any inebriant, even alcohol is dangerous, but, ketamine should not be used in a non-medical setting. Yeah.
Another question, and we've got 5 minutes left. This next question, if I work with my therapist on a weekly basis, what benefits do you believe doing integration on premises right after treatment has more than working with your therapist?
Yeah, remember integration is not therapy. So it's very important. Integration is creating a safe space, working on your intentions. It's not about going into your past and trying to process anything. It's about preparing you and creating a safe space where you can go and and really let go and surrender into the experience, so you get the most out of the experience, and then to help process what comes up in the experience afterwards. So it's not, it doesn't contradict, it shouldn't conflict with the therapy you're doing. It really shouldn't. Obviously there's many different ways of doing this. There are therapists using ketamine or, lozenge and other ways. It might have a different use. There's even, there's therapists who use lower doses or psycholytic doses of ketamine in lozenge form, and they do psychotherapy while under the influence of the ketamine. It's a different form. Some people find it works. It's not the way we do it here. It's different than psychedelics. That's not a psychedelic. So a psychedelic is truly going into yourself, finding the answers within yourself, rather than having, to, speak about it or use necessarily therapy while under the influence. So it's just a different way of doing it. That's not the way we do it here. Yeah, so it
Yeah.
doesn't.
And part of the distinction can be Nushama offers preparation and integration, which are therapeutic, versus traditional psychotherapy, which is a separate sort of
Right.
field. Is that what you're saying?
Yeah, and what we do, yeah, and so we do have what we call extended integration and therapy here. So there is a place for therapy, of course, and we do have therapists here who people can work with who aren't working with a therapist currently. We do offer prolonged or therapy sessions to help support them after they've completed after their treatment protocols complete. So that we do believe in that, and the ketamine and psychedelics in general. The way a lot of therapists I've been working with here and who've referred their clients to us find that after they've completed or they've gone through the protocol, they're much more open. They find them much more open to the therapy. So they've sort of intellectualized a lot of the years of therapy, but they haven't taken it to heart. They haven't internalized it. They haven't experienced it. So when they go through the ketamine, they find that their clients are much more open to some of the suggestions, some of the things that they've been trying to work on for years. They find them more empathetic and trying to find compassion and all that for them. They find they're able to go there much easier, and so it moves their therapy along in a much more efficient in a more easy with greater ease. Yeah.
Okay.
It's complementary. Yeah.
Final question. Do you recommend any specific podcasts for ongoing improvement? If not, you should do one. Oh, that's nice.
Yeah.
Stephen, any favorite podcasts for people?
Jay and I were Jay's on here, but I think we were filming some podcasts, which were great. We're going to post them. But yeah, I feel I've been on a number of podcasts like Dr. Phil, and we just did one yesterday. I mean, I've done a number of them, and I love it. I mean, I like the more natural flow of a conversation. I think it's more real. And yeah, I love those. So I'm happy if anyone knows of it. If anyone's in the podcast world, I'm happy to be a participant or be on your podcast, because I enjoy that modality very much. Yeah.
Arlena mentions you were online. Yes, she has a podcast on recovery that we love, and thank you. You can definitely tune into that episode. Maybe we can share that in the follow-up. So thank you everyone for joining. As a reminder, go ahead, Stephen.
I did post the our Amazon reading list in the comments.
Oh yes, if you see the chat, you'll see the Amazon reading list, and we can also send a follow-up information email with all of this. And for anyone who might have had a question but maybe didn't want to share it in a public forum, that is fine. Feel free to email the team. Everyone tomorrow will receive an email with information about how to set up a consultation. And you will also receive a discount for treatment. And we will also be sharing this webinar with people who could not join. And if you are a member of the media and would like to talk to Stephen about this or something else more deeply, happy to set that up for you. You know where we are. So thank you, everyone. Thank you so much.
Thank you. Thank you.